Losartan, your comprehensive guide to managing blood pressure and protecting your health. Are you taking Losartan or have you been prescribed this medication? Understanding how Losartan works, its potential benefits, and important precautions is crucial for managing your health effectively. This video provides a comprehensive guide to Losartan, empowering you with the knowledge you need to make informed decisions about your treatment. Losartan is a medication known as an angiotensin II receptor blocker, ARB. It's primarily used to treat high blood pressure, also known as hypertension, in both adults and children who are at least 6 years old. Losartan helps relax blood vessels, making it easier for the heart to pump blood. This reduces blood pressure and the strain on the heart. Beyond hypertension, Losartan is also prescribed to reduce the risk of stroke in individuals with high blood pressure and left ventricular hypertrophy, a condition where the heart's left ventricle is enlarged. It's also used to treat kidney disease in people with type 2 diabetes and high blood pressure. It's crucial to be aware of certain warnings before starting Losartan. First and foremost, do not take Losartan if you are pregnant, as it can cause serious harm or even death to the unborn baby, especially during the second and third trimesters. If you have diabetes, avoid taking Losartan with medications containing aliskiren, another blood pressure medicine. Also, individuals with kidney disease may need to avoid this combination. In rare cases, Losartan can lead to a condition called rhabdomyolysis, where skeletal muscle tissue breaks down, potentially leading to kidney failure. Seek immediate medical attention if you experience unexplained muscle pain, tenderness, or weakness, especially if accompanied by fever, unusual tiredness, and dark-colored urine. Before taking Losartan, inform your doctor about any existing medical conditions. This includes heart disease, congestive heart failure, electrolyte imbalances like high potassium levels, if you are on a low-salt diet, liver disease, or kidney disease. As mentioned earlier, if you are pregnant or breastfeeding, it's essential to inform your doctor immediately. Losartan can have severe consequences for the developing fetus. Your doctor needs to have a complete picture of your health to ensure Losartan is safe and appropriate for you. Always take Losartan exactly as prescribed by your doctor. Carefully follow the instructions on your prescription label and any medication guides provided. Your doctor may adjust your dosage as needed. Losartan is typically taken once daily, and you can take it with or without food. Consistency is key to maintaining stable blood pressure levels. If you experience vomiting, diarrhea, or excessive sweating, contact your doctor. Dehydration can occur while taking Losartan, potentially leading to low blood pressure, electrolyte imbalances, or kidney failure. Regular blood pressure checks and blood tests are essential while taking Losartan to monitor your progress and identify any potential issues. Even if you feel well, continue taking Losartan as prescribed, as high blood pressure often has no noticeable symptoms. Store Losartan in a tightly closed container at room temperature, away from moisture, heat, and direct light. The typical adult dose for hypertension and diabetic nephropathy is 50 mg orally once a day. Your doctor may increase the dose to 100 mg daily if needed. For children 6 years and older with hypertension, the initial dose is 0.7 mg per kilogram orally once a day, up to a maximum of 50 mgs. It's crucial to use an oral dosing syringe or cup for accurate measurement, especially when administering the suspension form. It's important to note that doses exceeding 1.4 milligrams per kilogram or 100 milligrams daily have not been thoroughly studied in pediatric patients. If you miss a dose of Losartan, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Never take 2 doses at the same time to compensate for a missed one. In case of an overdose, seek immediate medical attention or contact the poison helpline at 1-800-222-1222. Avoid getting up too quickly from a sitting or lying position, as this can cause dizziness due to low blood pressure. Unless your doctor advises otherwise, avoid using potassium supplements or salt substitutes, as Losartan can affect potassium levels in the body. Losartan can cause side effects, and it's important to be aware of them. Seek emergency medical help if you experience signs of an allergic reaction, such as hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. Serious side effects that require immediate medical attention include a lightheaded feeling, like you might pass out, high blood potassium. Symptoms include nausea, weakness, tingling, chest pain, irregular heartbeats, or loss of movement, and kidney problems, swelling, decreased urination, fatigue, or shortness of breath. Common side effects may include dizziness, tiredness, low blood pressure, low blood sugar, diarrhea, back pain, and cold-like symptoms, such as a stuffy nose, sneezing, or sore throat. This is not an exhaustive list of all possible side effects. If you experience any unusual or concerning symptoms, contact your doctor for medical advice. You can also report side effects to the FDA at 1-800-FDA-1088. Losartan can interact with other medications, potentially affecting their effectiveness or increasing the risk of side effects. It's crucial to inform your doctor about all medications you are taking, including prescription drugs, over-the-counter medications, vitamins, and herbal supplements. Particular attention should be paid to diuretics, water pills that can increase blood potassium levels, such as spironolactone, triamterene or amiloride, and SAIDs, nonsteroidal anti-inflammatory drugs like aspirin, ibuprofen, and naproxen, and other heart or blood pressure medications. This list is not exhaustive, and other drugs may interact with losartan. Your doctor can assess potential drug interactions and adjust your treatment plan accordingly. Many people have questions about losartan. One common question is whether it's safe to eat bananas while taking losartan. In most cases, it's fine to eat bananas or other potassium-rich foods. However, individuals with poor kidney function, heart failure, a history of high potassium levels, or those taking certain diuretics should exercise caution and have their potassium levels monitored by their doctor. Other frequently asked questions include whether losartan blocks the receptor used by the coronavirus, the difference between losartan and valsartan, whether losartan causes rapid or irregular heartbeats or low blood pressure, and whether losartan and losartan potassium are the same or different drugs. Consult your doctor or pharmacist for answers to these and other questions you may have about losartan. Always keep losartan and all other medications out of the reach of children. Never share your medications with others, and only use losartan for the condition it was prescribed for. Remember, this video provides general information about losartan and should not be considered a substitute for professional medical advice. Always consult with your healthcare provider to ensure the information is relevant to your specific circumstances.